I am your student nurse, Vivian May B. Sangüesa from NUR 224B. Today, I will be demonstrating how to perform hand hygiene by using soap and water. For the purpose of removing dirt and microorganisms, hand washing is the act of washing one's hands with any liquid, with or without soap. It is the best way to reduce the risk for transmission of contagious diseases. Hand washing is the most crucial and fundamental strategy for avoiding and controlling illnesses. It is the only infection control strategy that truly works. In performing hand washing, we use running water in a sink that drains out. We also need to use antibacterial soap if necessary. Rub our hands against each other for at least 30 seconds to facilitate removal of microorganisms. Long nails and jewelry trap germs. It is best to keep fingernails short. If one wears a ring, it is better not to remove it before hand washing so that it can be washed too. Lastly, it is always better to use disposable paper towels when drying hands to ensure that they are used once. According to the World Health Organization, there are 5 moments for hand hygiene. Moment number 1, before touching a patient. Number 2, before clean or aseptic procedure. Number 3, after body fluid exposure risk. Number 4, after touching a patient. Number 5, after touching patient's surroundings. Promoting and maintaining our patient's health as well as preventing the spread of infections are one of our duties as student nurses. Now, I am going to demonstrate how to perform a proper hand washing. However, before starting the said procedure, ensure that all of the required tools and supplies are ready, such as sink with warm running water, soap, and disposable paper towels. Also, keep our fingernails as short as possible. All of our jewelry, including watches, bracelets, and rings, should be taken off since they can harbor bacteria. First step is to stand in front of sink and regulate flow of water so that the temperature is warm. Warm water removes less of protective oils on hands than hot water. Next, wet our hands and wrists thoroughly under running water. Water flows from least to most contaminated area, rinsing microorganisms into sink. After having our hands wet, we'll apply a small amount of soap on our hands and we're going to lather it thoroughly. Then, rub our hands palm to palm in a circular motion. Friction and rubbing mechanically loosen and remove dirt and transient bacteria. I am now going to rub the back of each hands with fingers interlaced. Interlacing fingers and thumbs ensure that all surfaces are cleansed. Next, rub palm to palm with fingers interlaced. Okay, so now I am going to rub the back of each fingers with fingers interlocked. Now, rub each thumb in a rotational manner in each palm. Friction and rubbing mechanically loosen and remove dirt and microorganisms. Lastly, clasp the fingers and rub it in the palm of each hand. Also, rub each wrists. now done in washing, and now we will rinse our hands. Next step is to rinse both hands and wrists with water thoroughly. Keeping hands down and elbows up. Rinsing mechanically washes away dirt and microorganisms. Dry both hands from fingers to wrists and forearms thoroughly with paper towel. Discard used paper towel in a receptacle. Drying from cleanest to least clean area avoids contamination. Drying hands prevents chapping and roughened skin. To turn off faucet, use clean, dry paper towel, avoiding touching handles with hands. Wet towel and hands allow transfer of pathogens from the faucet by capillary action. And that's all for my written demonstration entitled hand washing.